Good evening, everybody. Welcome to tonight's class. Tonight we're going to be talking about something that is very controversial depending on who you are. So we're talking about what is regular care. What does that mean? Well, to a lot of people, regular care is very different. I will ask patients when they come in as a new patient and say, okay, well, they were under regular care. Well, what's regular care to you? And just like something being normal or common are two different things, regular care and what you believe care should be are typically two very different things. Let's take for account normal for your body to start breaking down, showing signs of arthritis or degeneration. Normal is over 100 years of age. Is that common? No, right? No, we see arthritis, sadly, and degeneration as early as teenage years, early teens. So we see it, right? It's common, but it's not normal. So let's look at what is common for regular care. Well, common for regular care is anywhere from whenever you hurt to once a month, once every few months, etc., etc. That's not what regular care actually is. So studies have looked at what is the requirement for a body to be as healthy and functional as possible, and that is to get your body checked for subluxation once at birth and once a week thereafter for the rest of your life. Kind of like brushing your teeth. You want to brush your teeth twice a day. Why? Well, you avoid things like cavities. You avoid things like root canals. You avoid things like tartar buildup. Well, it's kind of the same thing if you get checked once at birth and once a week thereafter. You avoid things like scoliosis, degeneration, malpositioning, malalignment, arthritis, disc issues. Now, is this taking into account those accidents that we have, the falls, the bumps, the bangs? Absolutely not. There's nothing that can prevent trauma, okay? And a body that has been adjusted and maintained in a healthy spinal alignment is far quicker to be corrected upon those traumas and have far less lasting effects from those traumas than one that is not. There's a study that I looked at that goes over VA, okay, the Veterans Affairs, and veterans coming back from overseas, from Afghanistan and Iraq. And they were going to Norfolk, to the hospital there. And what they saw is those patients that were under chiropractic care as part of their routine, they didn't need as much surgery, didn't need as much medication, took less time in recovery. I mean, it's no brainer, right? We looked at, Blue Cross did a study, I believe it was 10,000 people, don't quote me on that. This was years ago now, but did a study that I learned about when I was in school with pregnant moms. And those under chiropractic care, how many needed a cesarean section versus how many needed one that were not. And it was astronomically different. Now, why is that important? Well, recovery time from a vaginal birth is much quicker than recovery time from a surgical procedure like a cesarean section. Not only that, a natural birth with no drugs doesn't affect the baby, right? Where a cesarean section with a epidural, that's going to cross the blood-brain barrier, which means it can affect the baby. So lots of little things like that, okay? So when we look at all of the different things that you're dealing with, we want to focus on what is the most right thing for you and your body. I will never recommend less than once a week care for my patients. I've had a few people actually even write a review that said, oh, this is ridiculous. I shouldn't have to come once a week. You don't have to. Just like you don't have to brush your teeth. You don't have to, you don't have to pay your bills. But there's consequences for not doing the things that you should do, right? So if you don't brush your teeth, you're going to have problems with cavities, erosions, gingivitis, tartar, plaque, bad breath, yada, 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 right? You don't take care of your spine, you're going to end up with degeneration, malposition, arthritis, pressure on the nerves exiting the spine, lots of other issues. Yes, pain is one of those things, but there's a lot of other things that are part of that. I don't want that for you. So I recommend once a week care. Why? The Best Practices Manual, which is the manual that I go by as far as my recommendations for care, says that there's a benefit for senior citizens, okay, to be adjusted well over 100 times in a year. Wow. They're benefiting from that. There's also proof in there that even Medicare states that if somebody has arthritis or degeneration in one segment, it automatically causes 30 visits minimum for that patient. Well, I mean, if you're talking a year's 52 weeks, and you can hop on. Sorry, patient just walked in, and you guys know I like to try to do these. So 30 visits, well, there's only 52 weeks in a year. And that's just if it's in one segment, not if it's in 2, 3, etc. So keep that in mind. So what is regular care? Well, in my opinion, if you haven't been under care and you're in your 20s, 30s, 40s, 50s, there's a lot of catch-up that has to be done, right? There's a lot of correction to the issues that you've had. So it's going to take a lot of work to get you there. And every case is different because everybody who comes in is a different age. Because everybody who's come in has had different life experiences. So if you come in and you're a 4-year-old, well, you're probably not going to require, 4 days a week for 3, 4, 5, 6 weeks. But you're going to require some decent work, okay? Versus if you're 70 years of age and come in, you're probably going to need a lot more work if you've never had care before in the past. Because my job is to get you functioning correctly, first and foremost. Yes, pain is a factor that we deal with, but it is not my primary factor on where I expect your results to be. I care about your function. If you're wondering why, you can look at all my other classes that we've talked about where pain is just a small part of what your body's information is. And that's why I don't base it on that. So what is regular care? Getting checked once at birth, once a week thereafter, for life, for health, for the achievement of your best. That's why. So if you're wondering why I do what I do or how I can help you, go ahead and leave a comment below. Let me know. I'd love to help you. I'd love to help going forward from here. And I'd love to see what your body can show you what you can still do, even though you've missed years of potential correction. It's really neat to see what your body can do when given the opportunity to do it. So give us a call. I look forward to seeing you all very, very soon. And as always, I'll see you later this week and early next week for your regular checks. Thank you.